Hello, my name is Daniel Singer, and I work at the emergency department at the Renaissance School of Medicine at Stony Brook University. And I present to you today a study entitled Urgent Care Center Proliferation is Associated with Reduced Emergency Department Visits for Lacerations, a national and local study. And I present on behalf of my co-authors. We have nothing to disclose during this project. Lacerations are a common reason for visiting the emergency department. Lacerations also can be treated at urgent care centers. And what has been a national trend is that urgent care centers have been increased over the last few years. We hypothesized that the number of lacerations treated in the emergency department would decline despite increases in overall ED visits. And we also hypothesized that the proportion of complex and long lacerations in the emergency department would increase. The study design is a retrospective review in which we looked at three separate data sources, the first of which was the National Hospital Ambulatory Medical Care Survey, or NAMC's database, which is sponsored by the CDC and includes national estimates that calculates based on weighted sampling. We looked at the Urgent Care Association website, and we also pulled data from our suburban medical center at Stony Brook, using our electronic medical records and billing database. The study subjects were all ED patients with lacerations between the years of 2006 and 2016. The measures we used were reasons for visit, physician diagnoses, demographics, comorbidities, diagnostic tests, procedures, and disposition. And we analyzed our data by looking at the changes in the absolute number and relative proportion of ED visits from lacerations over time, and we compared these trends using chi-square data analysis. As we see here in the graphs, the total number of ED visits between the years 2006 and 2016 annually have increased over the US from 120 to 145 million. In the second graph here, during that same time period, the number of ED visits with lacerations has decreased from about 5.25 to 4.75 million, and the relative percentage of ED visits that included lacerations dropped from about 4.5 to 3.25% and has remained relatively stable from the years 2013 to 2016. During the same time period, the urgent care number has increased steadily with an annual growth rate ranging from 5 to 12%, reaching a number of 8,125 by 2017, and only will be growing in the future. At our Stony Brook Center, we looked at the total number of ED cases, which we can see in the top graph has increased steadily with a small decrease between 2016 and 17, with a large trend. And in the second number, we looked at our intermediate care cases, which include minor injuries, fractures, sprains, and strains, as well as lacerations, which has had a trend of decrease as well. And on the bottom, we see that the percentage of ED cases with open lacerations has decreased at our center as well. And we also looked at the relative proportion of intermediate and complex lacerations, which remained low and steady, as did the proportion of lacerations longer than 7.5 centimeters. Some of the limitations of this study include a selection bias, as this was a retrospective study, and we had a limited data set, which could have had residual confounding. Our conclusions that we draw are that despite increases in annual ED visits at the national and local levels, there has been a reduction in the number and proportion of ED visits for lacerations. The decline in ED lacerations has occurred as the number of urgent care centers has dramatically increased. And we saw no change in the percentage of long lacerations or complex lacerations as a total number or percentage of ED visits. Thank you for your time.